The excitement of Impact and Compact was that we were able to introduce a new technology on a broad scale. It was very much a success in terms of organizing the infrastructure to do this type of testing and to help us sort of transition towards the next generation of precision cancer medicine. The purpose of Impact and the parallel study Compact was really to look for certain individual mutations in patients who had types of cancers that had spread to other parts of the body, in the hope that it might give their oncologists more information to direct them towards new treatments in clinical trials when standard treatments were no longer effective. Of those patients where we generated a mutation testing report back to the clinician, in about 5% they eventually went on to clinical trials which matched treatments. Patients who went on those types of clinical trials had a higher response rate, so they were more likely to have improvement in terms of their cancer. In order to better understand what some of these mutations may mean, we know that we're going to have to share our data with other institutions. We're also collaborating with a number of other institutions who've done this type of testing through a very large international project that's being led by the American Association for Cancer Research, where we've contributed our data from Impact and Compact. We've also started another study called Octane, together with 4 other cancer centers in the province, where we're moving towards a much larger testing panel. As we learn how best to use these types of technologies in terms of DNA sequencing, we'll see more and more that this type of testing is integrated as part of routine patient care. We're certainly not there yet, but I think with time, as we build the evidence base through these types of data sharing projects, we'll get a much better understanding of how to individualize cancer treatment for patients using the mutation profiles in their cancers. I'm Dr. Philippe Bedard. I'm a medical oncologist at Princess Margaret Cancer Centre.